Aloha and welcome to Ke Kumu, a podcast of the DKI Inouye Asia-Pacific Center for Security Studies, where our goal is to educate, connect, and empower security practitioners working in the region of consequence, the Indo-Pacific. I am your host, EJ Bartolome, and our special guest today is Dr. Sebastian Kevany. Bas, thanks for coming. Appreciate you being here. You're an expert in health security, health diplomacy, and global public health. So health is pretty much a big theme for your life, it seems like.
It is for sure, EJ. I'm grateful for the opportunity to be working here on such a topical subject.
So one of the areas where you maintain your own health is surfing. Can you tell us, how did you get involved with a surf culture?
It's something, I guess, that has been with me, since an early age. I grew up by the ocean in Ireland, and at a certain point in life, that translated into surfing. I was lucky to spend time in California, in Australia, in South Africa, and now in Hawaii, all places that enabled a surfing lifestyle.
And this is a photo, I think you said this was you in Sierra Leone. How did you find yourself surfing here?
Yeah, that was unexpected. I was there for an Ebola investigation, a post-Ebola evaluation. I heard that there were waves further down the coast, so I had time at the end of the mission to travel down there. It was rough roads, tough conditions, but we got there. We found beautiful waves, a little surf club on Bure Beach, and some great people and fond memories. This particular picture is from South Africa, a place called Bruce's Beauties, which is around the corner from Jeffreys Bay. It's a wave that breaks very rarely, and it was made famous by the original Endless Summer movie. So it's those kind of experiences that made a lot of the travel worthwhile. But I think that any kind of connection with the ocean, whether it's surfing or anything else, that's what is important to me.
And you have a book, actually, it's called Between the Moon and the Fire, Life and Surfing Moments. So in your book, you say surfing, it's a magical experience. Can you explain what makes it so magical for you?
I think, there is a spiritual side to it, as well as the social, the cultural, the physical. There is an element of focus that you get when you're surfing. The past is gone, the future is irrelevant. You're doing all of the right things in terms of meditation and those kind of elements of life. You're just being there now, and I think that's very powerful and very healthy.
In addition to all of your travel around the world surfing, you have over 100 in the field missions related to global health diplomacy, and those are travels with the World Health Organization, the United Nations. Can you tell us about these missions, about what was your purpose and some of the places that you went?
It was a path that, like so much of life, is serendipitous. I think I was lucky in going to South Africa to study there and gaining exposure to developing country issues firsthand, especially the health issues, infectious diseases, HIV, TB, malaria. From there, I was considered a good person to go to places like Zimbabwe, which happened to be suffering from economic, political, security issues as well. So having done a series of missions there, things evolved to places like Ethiopia, Tanzania, Uganda, Kenya, Mozambique, but also to even more challenging environments, Iraq, Afghanistan, Egypt during the Arab Spring. And I guess in retrospect, each mission was a way, an opportunity to prove yourself, not just in the field of global health, whether it was monitoring and evaluation, cost effectiveness, health security, health diplomacy, not just the diversity and the camaraderie, but also the essential nature of being able to work together as a unit, as a team, coherently, harmoniously, with a sense of humor, with people who you have never met before and may see again for short and intense periods of time.
And so your experience with all of these missions, it seems like it played a lot into a book that you recently published. It's called Barefoot, Global Health Diplomacy. Can you kind of explain for us what is Barefoot Global Health Diplomacy from your perspective? I think that's something that you learned as you were in these remote places and traveling on these missions.
Yeah, you know, I read a quote the other day that for a lot of academic and other people in life, research is me search. I started to think more about what I was doing and why I was there and why those expenses were justified in the eyes of someone in a headquarters somewhere. And I came to the conclusion that it's not just about advancing health, it's about advancing international relations and communications and collaboration. So even though I have no formal training as any kind of diplomat, I thought that the phrase barefoot diplomacy was appropriate, because I guess I was in bare feet literally sometimes as well.
You might be one of the only people they see from outside of their country or from another part of the world. It really takes a globalized mindset to be a barefoot diplomat, it seems.
That's a critical element, and I felt more and more like you only get one shot at these things. Okay, you might return to the same clinic a year later, but very often it would be your one and only chance to communicate directly with people on the ground. And so it's an opportunity for me, but it's also an opportunity for them, and it's an impression that is left indelibly on both sides. You're not just representing yourself, but your organization and your country as well.
That really relates to what we do here at the Asia-Pacific Center, where we're bringing in security practitioners from all over the world. They're not formal diplomats, but they're representing their country. That cultural exchange is something that happens here at the jobs that we have at the Asia-Pacific Center, so I'm sure that relates.
You know, I feel it resonating. Obviously, everything has been flipped, because before I used to go out there, but now everyone comes here in a strange way, in an almost inexplicable way. You get that same feeling, as if, you know, you're being exposed to the world, and the diversity of cultures, the incredible capacity of each of the fellows to represent themselves and their countries, to act diplomatically, to behave as what you might call a barefoot or informal ambassador. It's a privilege to be around, and it leads to such a productive and magical dynamic, both between faculty and fellows, and of course amongst the fellows themselves.
Let me bring you to our major course that we hold here. It's the Comprehensive Security Cooperation course. It's our 5-week program. And so the main topic that you lecture here is on global health security. So for folks who don't know what global health security is, can you help us understand what that is and help define it?
It's certainly, like I said, a topic that is relevant to today's world, in my opinion. Okay, you know, everyone got a bit burned out on health security and related subjects during and immediately after COVID, which was in a way all about health security. To me, that encapsulates the focus on infectious diseases, on containing and controlling their spread around the world, and on the implications for sovereignty, for national borders, and of course for security. What has traditionally been a realm of academia that has focused on warfare, conflict, international relations, has expanded exponentially in recent years to include health, to include climate change, to include economics, cybersecurity, all of these new definitions of security that we ourselves are still coming to terms with. So I'm really proud that health security is something that the Center chooses to focus on.
For the countries in the Indo-Pacific, what is the next steps for improving health security in this region?
You know, historically, I think you got to look to the past to understand the future, and so much of health security in the region throughout history was to do with colonization and new diseases, and smallpox or TB, these epidemics brought in under the colonial system. And of course, that was devastating for the region. Now, again, it's almost come full circle. We live in an age of globalization, of rapid transport and travel, of migration, and the question is, can the health security of a Pacific Island nation keep up with the pace of globalization? As borders are increasingly eroded, as we increasingly become literally one world and one people, how is any one country capable of maintaining health security independently? So I think the key, the solution has to be collaboration. Countries working together and no one country going it alone and saying we're going to have a perfect health security apparatus in our own country, because it's useless if your neighbour isn't equal to your capacity. The chain is only as strong as the weakest link in that regard. The COVID response was also something that is still unresolved. We did so well. It was a global effort. We were ultimately victorious, knock on wood, at least for now. We got the vaccines out, we took the measures, we all learned from each other. There was an incredible groupthink that transcended in its power and influence, even the media, even the WHO. There was something seismic and historical happening in that regard. But there are unresolved questions. There were mistakes. And we still have to learn from them and be prepared for what may lie ahead.
All right. Vas, thank you for your time. Appreciate you being here. And to our fellows in Ohana watching from the region and beyond, I'm your host, EJ Bartolome. Ahui ho, until we meet again.